Hello, this is Dr. David Green, Education Director at Premier Pain Specialists in Chicago. Today's topic is an overview of medial branch blocks. Back pain and neck pain affect 90% of Americans at some point in life. Back pain is the second most common reason people see a doctor, just behind the common cold. It's a leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. 10% actually get worse. And the cost of back and neck pain exceeds $100 billion annually in the U.S. When you look at the facet joints of the back and the neck, they are bilateral at every level. You can see there's a facet joint here, 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 here. It goes all the way up the back into the neck. The facet joints cause pain 45% of the time when someone presents with back or neck pain. The intervertebral disc, which you can see here, 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 that's the source of one's pain 40% of the time. So if the facet joints are about the size of a thumbnail, they do have cartilage and they are prone to arthritis just like the hip or the knee. They can be small, but they can cause humongous amounts of pain. Now, diagnosing the source of the pain can be very difficult. A pain doctor will get a history, do physical exam, and then imaging studies, but even all of that can still make it very difficult. So here you see a CAT scan which shows the facet joints here and here. This looks great. There's no rattiness to it. It's very nice and smooth here. And you look over here, this has a lot of extra bone formation with bone spurs and kind of a ratty appearance. That has significant arthritis. But interestingly enough, that might not be causing a person any pain, okay? Now, the joints have to feel sensation to feel pain. And that sensation comes from these little nerve endings called medial branches. They go up and down. They're not the nerve roots, that's here. They're the little nerve endings that come off of the nerve root. And they're only sensory, they don't do anything with motor function. When you do a medial branch block, a pain doctor does it for one of two reasons, or both. Diagnostic, to say, okay, this person got pain relief from this injection, therefore that's the reason he's having pain. And therapeutic as well, they can provide pain relief for quite a while. Most modern pain doctors will use image guidance, which is a real-time form of x-ray or ultrasound. Numbing medicine is applied over the skin and then down in the soft tissues down to the area. Some pain doctors do use steroid, others don't. They just use numbing medicine. It's an outpatient procedure. You don't really need sedation for this. It takes under 20 minutes. Now, for the diagnostic part, it can help a pain doctor figure out if a joint is the source of the pain. If it does work well and then eventually wears off, a person can either have a repeat or move on to what's called a radiofrequency ablation, which can deaden these medial branches, thermally ablates them with heat, and it can provide pain relief for anywhere from 6 to 24 months. The therapeutic part of medial branch block is that in and of themselves, they can show an average pain relief of over 3 months. The procedure works well in 85% of patients, and if you need to have a repeat procedure, it can work just as well, or move on to a radiofrequency ablation. This is what a radiofrequency ablation looks like. A catheter goes into the same area. It heats up and then kills these little nerve endings that were providing sensation and pain to the joint. And as mentioned, it could provide pain relief for up to 2 years. The top non-operative pain management in the greater Chicago area is with Premier Pain Specialists. They have several clinics now throughout in and around Chicago, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. I'm Dr. David Green with Premier Pain Specialists. Thank you so much for watching today.